Last year, November the 14th. That's the day I was diagnosed with stroke and also diabetes.
So early supported discharge is a program in which patients receive intensive rehabilitation at home rather than in hospital. They're seen twice a day by Allied Health and once on a Saturday, in which they receive similar rehab to what they would get in hospital but at home.
So the model for improvement has three questions. The first is, what is it that we're trying to accomplish? So this is where the team really thinks about the aim of their project and also defines the charter and the scope of their project before they start.
What we were trying to achieve with the project was to reduce the average length of stay for patients who had had a mild to moderate stroke by 4 days and who lived in a small geographical location. We wanted to do this with comparable outcomes in the community, and we were also looking for a patient satisfaction rating of above 90% with the service.
So the next question is, how will we know that a change is an improvement? So this is really about defining the measures that you're going to use for the project, so that as the project goes along you can test out changes and see if it's having an impact on those measures. So these are really the outcomes that you're trying to achieve and any process changes that you want to make and identifying how you'll measure those. The main measures that the team was interested in looking at was the length of stay for patients in the rehabilitation ward in Middlemore Hospital. This would tell them whether or not having an early supported discharge service, which supported the patients out in the community instead of the hospital, was having an impact on the length of stay and hopefully reducing it. The second measure was looking at the functional improvements that the patients were making. The third measure was around the patient satisfaction, so making sure that the new environment and way of delivering the care was satisfactory to patients and also to their families. The third question is, what changes can we make that will result in an improvement? So this is where the team takes their knowledge and understanding of the process or the system that they're working in, any data that they've worked on, and start to develop change ideas and theories about what changes they could make that will lead to the outcome they're looking for. And then they take those changes and start to test them out and see if that has an impact on their measures.
Along with the strong research that supported early supported discharge, we felt that in order to bring the service to New Zealand, we needed to test it to know that it would work in our own environment. To ensure the safety of our patients, we started with one patient who was already ready to discharge. We then increased it to more patients and increased it to taking patients early.
So the word home, it makes me really push myself, and I just can't wait to come home.